another study that was done more recently that said that rapamycin made arthritis worse, but that was at a chemotherapeutic dose. Leucine is another supplement, guys, that should be on your radar. It's an amazing amino acid. Remember, those long-chain omega-3 fatty acids are really important for your brain and your eyes. We talked about plasmalogens, but you need the plasmalogens along with the DHAs, right? Do not ever take testosterone orally. It is quite toxic to the liver taken orally.
Welcome to our Q&A highlights. Q&A sessions are recorded every month, and our enhanced members get an exclusive opportunity to ask questions from one of cellular medicine's brightest minds, Dr. Elizabeth Yurth. Get a chance to ask your questions by becoming our enhanced member at bli.academy/memberships. You also get access to our content library full of tips, articles, videos, lectures, previous live Q&A sessions, and more.
David asked, what's my thoughts on rapamycin as a treatment for osteoarthritis? So for those of you who don't know, rapamycin is a drug that's kind of hit the big time in the longevity enhancing world. So basically, it's an old drug from the 50s that was used as an immunosuppressant agent for people who had organ transplants. So people who had organ transplants, they would put them on high-dose rapamycin on a daily basis, and that would keep the immune system suppressed so that they would not reject the organ. And then it kind of fell out of favor because they found better drugs and decided it wasn't as good, but still utilized to some degree. Also was used as a chemotherapeutic agent. That's at a high dose. But at a low dose, on a once-a-week basis, what you do is basically get rid of bad damaged cells and then rebuild, so it's like taking out the trash. So low-dose rapamycin on an intermittent basis, huge study going on in dogs as well right now in the veterinary world, is a great lifespan extender and probably health span extender. And there's studies showing it improving almost every age-related disease. The 2019 study showed that there was decreased severity of arthritis, reduced inflammation, reduced bone erosions, and new bone formation. There is another study that was done more recently that said that rapamycin made arthritis worse, but that was at a chemotherapeutic dose. So like using more like a high dose on a daily basis. So again, this is another drug that is very, very dose dependent. A high dose is not going to help you. A low dose is. The biggest question is, what is that dose? And that's what we're not yet entirely sure on. So most people use a pretty small dose once a week. We've based that off the animal studies. I think only time will tell, do we need to be dosing it more aggressively? Don't know that yet. But I think you're very safe doing a low dose once a week. And it definitely has been shown at that kind of dose to be beneficial in halting the progression of arthritis and helping with pain. I've noticed it myself. So with rapamycin, I've noticed pain's pretty well controlled with penicillin, but the rapamycin seems to have helped with more motion. And like my knee was doing a lot of locking, wasn't painful, but it would lock a lot. I've noticed less of that. Then Kristen from Colorado asks, what peptides are best for gut health? Asks about collagen, curcumin, and BPC 157. And she says, BPC seems to have so many benefits. Is it really that awesome? Yeah, it is. I think BPC is a wonder peptide. You know, honestly, sometimes some of the things we utilize, they seem too good to be true. And I think BPC is kind of one of those things. It really is. So BPC has been shown, BPC, for those of you guys who don't know, remember peptides are short chains of amino acids. I think BPC is about a 16 amino acid chain. And BPC is something we make. It's made by our gut. So our gut makes BPC in response to injuries. As we get older or we have chronic injuries, then we see the body protective compound levels drop. But it's been shown to heal stomach ulcers, improve wound healing, increase cellular regeneration, boost bone healing, protect organs, reduce muscle wasting, so it helps with muscle building, promotes new blood flow to areas. Also really helpful for gut. So there's great study that showed in mice, they actually put a big, huge hole in the gut, you know, so they put a fistula, they made an entire hole through the gut, and BPC given to those mice completely healed the hole in the gut. So we know it's really helpful for ulcers, people who have chronic gastritis or colitis. It was also helpful for irritable bowel syndrome, people who have intestinal bowel overgrowth, Crohn's disease, leaky gut. It's also one of the few peptides that's stable. So it's gastric stable. So it's actually better for the gut when you take it orally, whereas most peptides get broken down in the gut. So that's why you have to do most of them as subcutaneous injections. BPC is stable in the gut, so you can use it orally, and that makes it simpler to take, but it also had better benefits in the gut. I love this peptide. I honestly, I know it sounds too good to be true. It is. I mean, except for like most peptides cost. But otherwise, it really is a remarkable healing thing. It's one of my favorite peptides. And if I get injured, I go right to BPC and thymosin beta-4 together to help heal the injuries, and it'll heal much more rapidly, or post-surgery or things like that. Or if you're somebody who's chronically taking anti-inflammatory drugs, we know that BPC was really protective against steroid-induced ulcers and anti-inflammatory induced ulcers. So if we have somebody who has a high risk of ulcers, we can use BPC as a protective agent as well. So a great peptide. It's one to really keep in your mind when you have any kind of GI stuff. And Brian's happy to talk to you and give you other options as well. Next question. My gynecologist just prescribed testosterone for me only after I pointed out how low my free T was. 54 years old, haven't started menopause, but my hormones are decreasing. Testosterone was 7 and free testosterone was 0.5. So those are god awful low. We like to run women free testosterone levels, probably almost 10 times that, depending on the woman. Some people feel good a little bit lower than that. So started her on a transdermal cream. And that's really the only way you want to do testosterone, is either as a transdermal, meaning rubbing it into your skin, or as a subcutaneous injection. So you can do it as a little injection. Do not ever take testosterone orally. It is quite toxic to the liver taken orally. So transdermally or subcutaneous. The big key, and there was a great article that looked at where the best place to put transdermals were, and what they found is that it was a little different for everybody. You want to find an area that's hairless. So, inner arm, inner forearm, top of the butt cheek, soles of the feet, all areas that don't have hair follicles, because hair follicles will convert the testosterone into estrogen, and you'll lose some of the benefits of the testosterone. So we want to find a hairless area. You want to rotate sites. So you want to actually change the site periodically. Otherwise, you actually start changing the receptors. So don't use the same site over and over and over again. You also will find if you use the same site over and over and over again with testosterone, you can't actually grow hair at that site. Testosterone will grow hair on any part of the body that has hair follicles, except the head, oddly. So there's hair follicles all over your body, with the exception of your soles of your feet and your palms. So those areas actually will not grow hair, and you can use them a little bit more repeatedly. And so I like the soles of feet at night. There was a great study because people said, well, it's thicker skin on the soles of feet, it's not going to be as well absorbed, but it actually was, it was pretty well absorbed. Now, what I will say from the study is that it was very different for different people. So if I have somebody who's not responding to a transdermal hormone, I may have them just try a different site than what they're using to see if they get better response. As far as a vaginal, so we'll have guys do testosterone sort of scrotally because it is really well absorbed scrotally. The problem with vaginal testosterone is there's some interesting studies done primarily in transgender people where using testosterone created some changes in the vaginal epithelium, and that wasn't such a big deal in these transdermal or in these transgender people, but in normal women, you don't really want to thin out or change the vaginal epithelial wall. So I'm not a fan of vaginal testosterone. Vaginal estrogen, on the other hand, is helpful to the epithelium of the vagina. So that's fine. But testosterone, I would be very cautious with doing that vaginally. I wouldn't use it that way. And then if people aren't getting a response from transdermals, then you can switch them to a subcutaneous injection. Easy to do. You do it a couple times a week. So it's sort of, we have people who just, for some reason, they're not getting any response from transdermal, we'll switch them over to a subcutaneous injection. Fawn also asked about leucine. And leucine is another supplement, guys, that should be on your radar. It's an amazing amino acid, has huge muscle building potential, fat loss, mitochondrial health. Study in 2021 where they used leucine, sildenafil, so Viagra, and metformin, and they had great weight loss benefits from like a low dose, 1 milligram of leucine, and really robust weight loss, especially when those three were combined together. So there's also another study that showed that it improved mitochondria in skeletal muscle by just taking leucine. And in fact, great study in women who had poor muscle mass, that instead of doing a big protein bolus after exercise, if they just did a leucine, they had the same muscle growth as people who did a big protein bolus. So you can give just leucine and potentially get muscle building benefits without having to go and eat a whole bunch of food right after your workouts, right? So eating a big protein load right after your workouts. So we love using, for instance, like injectable leucine, things like that, or you can take it as an oral supplement available from, again, even companies like Bulk Supplements, make leucine. It's very easy to find and doesn't really have any bad downsides to it. It also really reduces inflammation. So if you're working out a lot and you take leucine after your exercise, you not only build more muscle, lose more fat, but you'll recover faster. So I love leucine. I'm glad you asked these questions because those are kind of a couple of my favorite supplements, actually, is leucine and alpha ketoglutarate. Sandy also asks, if you are a vegetarian, can you get enough omegas and DHA in protein? And the answer to that is not without supplementation, especially as vegans. So you absolutely have to supplement methyl B12. So we know that it is impossible probably to get enough methyl B12, methylated B12, not cyanocobalamin, but methyl, which is what we need. It's almost impossible to get that from a vegetarian or vegan diet because it's at its highest content in meats. You can get some, like nori seaweed has some, nutritional yeast has some methylated B12, but how much nori seaweed and nutritional yeast are you going to eat? So really, we recommend all of our vegans, all of our vegetarians supplement with a methyl B12, like 5,000 micrograms sublingually daily. You have to. Things like EPAs and DHAs are mostly found in animal products, fish oils. So remember, those long chain omega-3 fatty acids are really important for your brain and your eyes. We talked about plasmalogens, but you need the plasmalogens along with the DHA.